For the first time, we're starting to see data on the impact lockdown restrictions are having on our mental health. Earlier this week, a YouGov study found that more than 50% of Australians are feeling stressed and isolated. Well, there are resources available and ways companies can step up to support its workers during this time. And for more on this, I'm joined by Marcella Romero, CEO of Rehab Management. Marcella, thank you so much for your time.
Pleasure.
So we're starting to see data around how lockdown restrictions are impacting on our mental health. What should companies be doing, or what should employers be doing to support workers during this time?
Look, there's no doubt that the coronavirus is changing the way we live, the way we communicate and the way we work. I believe that employers have a significant role to play in promoting and looking after the health and the well-being of their workers. There's so many initiatives and strategies that they can employ. I think an important one here is communication. We absolutely need to keep employees informed about what's going on, and there's different ways we can do that. For example, at Rehab Management, what we do is we have a very robust communication strategy where we're communicating with our employees 3 times a week. Bulletins, they consist of providing information about the symptoms of COVID, how to manage it in the event that they find the symptoms, and also just keeping tracking on the health and well-being. A way we're also doing is we actually developed a digital survey where we're sending them out twice a week. And what we do is we try to find out whether they are experiencing the symptoms or how they're feeling. And we digitally do that because we have 400 staff across the nation. So it's absolutely critical that we do that, and we do that twice a week. Employers should also be encouraging their employees to have regular routines. I think that's really important, to have regular routine where they set a time to start work, regular breaks and so forth, and ways to engage and continue to connect with people at the workplace is absolutely critical to keep them connected, engaged and motivated. Another thing about working from home is not just the mental well-being of individuals, it's also physically, is that some may be experiencing physical deconditioning because they may not be exercising. So it's absolutely critical that we encourage them to exercise and ergonomically set them up at work. At home, sorry.
Absolutely. I think that routine is critical right now, especially if people are working from homes, could be in their bedrooms, could have lots of people around, and I'm sure a lot of people are really missing going into the office and seeing their co-workers. Sadly, many Australians have been stood down in recent weeks. What do you think companies should be doing? Is there anything they can do to make that process easier for workers?
Look, if a company has employee assistance programs or EAP, absolutely give them access to that, where they have counselling sessions and so forth. If employers don't have EAP program, perhaps they should link them to community resources, mental health programs such as Beyond Blue. They offer 24/7 counselling sessions or online sessions as well. That's really important.
Do you think there's anything we should be taking away from this time? You know, we've all having this we're having this experience of so many of us working from home. Do you think that we'll be working differently when this pandemic is over?
I believe so. I think that what's working from home is that there's a notion that you can still be productive because we are using telehealth, and I think that employers may change their work practices. They may choose to have working from home, a balance from working from home and working from the office because people are being productive. So I think there will be some changes once this is all over.
Unfortunately, we do have to leave it there. Marcella, thank you so much for joining me this afternoon.
Pleasure. Thank you.